Hello, I'm Dr. Jerry Morris, and I'm the Clinical Director of Community Mental Health Consultants in Nevada, Butler, and Harrisonville, Missouri. I'm here to talk to you about an exciting new program called our MAT program, or our Medication Assisted Treatment Program. Medication assisted treatment is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorders. Research shows that a combination of medications and therapy can successfully treat these disorders. And for some people struggling with addiction, MAT can help sustain recovery. MAT is primarily used for the treatment of addiction to opioids, such as heroin and prescription pain medication, but it can also be used for serious forms of alcoholism with cravings. The prescribed medication operates to relax brain reactions to the loss of the drug and thus physical urges to relapse and related discomfort, which can interrupt treatment. Some medications block the euphoric effects of alcohol and opioids, relieve physiological cravings and body functions, and quell the negative effects of getting used to life without the abused drug. Combining some of the medications used in MAT with anxiety medications is a real red flag caution and can be fatal. These medications that should not be combined are generally benzodiazepines such as Xanax or Valium or Klonopin. Opioid treatment programs provide MAT for individuals diagnosed with an opioid use disorder. These programs treat all aspects of chemical dependency as well as related health and psychological problems, occupational and educational problems, and family problems that can create stress and triggers to relapse and interrupt commitment to recovery. Opioid treatment programs focus on improving the quality of life. Federal law requires patients who receive treatment in opioid treatment programs to receive professional assessment and diagnosis to establish scientifically valid medical counseling, vocational, educational, and other treatment services, including medications. Counseling and behavioral therapies. Under federal law, MAT patients must receive counseling, which could include different forms of behavioral therapy. These services start with professional diagnosis in order to select scientifically valid counseling and or psychotherapy interventions that are included and provided to have an effective care plan for the patient. Additional diagnoses may follow the assessments that indicate that medical, vocational, educational interventions that are scientifically valid may be necessary to return the patient to health and well-being. MAT effectiveness. Now, MAT is a scientifically validated package of therapy and medication treatments and has therefore proven to be clinically effective and to scientifically reduce the need for inpatient detoxification services and to increase adherence or the ability to stick to long enough treatment to achieve positive effects for individuals. MAT provides a more comprehensive, individually tailored program of medication and treatment for addiction. Like all modern treatment programs, MAT also includes support services that address the patient's needs. The ultimate goal of MAT is recovery, including the ability to live a self-directed life. This treatment approach has been shown to do the following things and therefore has the following goals: to improve patient survival, to increase retention in treatment, to decrease illicit opiate use and other criminal activity among people with substance use disorders, to increase patients' ability to gain and maintain employment, improve birth outcomes among women who have substance use disorders and are pregnant. Research indicates that MAT can lower the risk of HIV or hepatitis C by reducing relapse. MAT and patients' rights. Under the Confidentiality Regulation 42 Code of Federal Regulations, or CFR 2, personally identified health information related to substance use and alcohol treatment must be handled with a high degree of confidentiality and more confidentiality than other medical treatments and records. Now, the medication used in MAT are as follows. The FDA has approved several different medications to treat opioid addiction and alcohol dependence. MAT medications help control the withdrawal symptom and psychological cravings that stress and discomfort can interrupt in therapy. MAT programs provide a safe and controlled level of medication to overcome the use of abused opioids and the healthcare monitoring and case management, which can ensure safety. When provided at the proper dose, medications used in MAT have no adverse effects on intelligent mental capacity, physical functioning, or employability. MAT medications can only be dispensed through an approved program. Now, the opioid medications that can be used to help in treatment include methadone, buprenorphine, naltrexone, and in addition, there are some short-acting opioids like heroin, morphine, codeine that these synthetic medications have shown to help with. People may safely take medications used in MAT for months, years, or even several years or a lifetime. It's all individualized and based on what helps the patient. Plans to stop a medication must always be discussed with the physician and the treatment team in the MAT program. Let's talk a little bit about buprenorphine. Like methadone, buprenorphine suppresses and reduces cravings for the abused drug by providing partial effects. It's actually called a partial agonist, so that it covers the receptor that the opiate drugs do, but only partially, and therefore limiting the euphoric or addictive effects. It can come in a pill form to place under the tongue or sublingually. Naltrexone is one of the other drugs that's often used to help the opiate addicted individual. Naltrexone works differently than buprenorphine. If a person using naltrexone relapses and uses the abused drug, naltrexone blocks the euphoric and sedative effects of the abused drug and prevents feeling euphoria. In other words, it's what's known as an opiate antagonist, and because it is covering many of the receptors, taking an opiate drug doesn't give the thrill or the euphoria or the high that it does unless you are not taking naltrexone. You can see the obvious benefits of these two medications. Now, opiate overdose prevention medications, the FDA has approved naloxone. Now, that's very different from naltrexone. And naloxone is an injectable drug used to interrupt an opioid overdose as an emergency stick pin to save addicted and overdose individuals' lives. According to the World Health Association, naloxone is one of a number of medications considered essential to the functioning of a healthcare system where there is so much opiate overdose and death. Let me talk a little bit about alcohol use disorder medications in MAT. There are basically three medications, disulfiram, acamprosate, and naltrexone, that are used with severe alcoholism in order to reduce cravings, to act as an inhibitor of relapse. And disulfiram is a medication that can effectively be a component of a treatment plan in chronic alcoholism. It is most effective in people who have already gone through detoxification or are in the initial stage of abstinence. It is a tablet form and is taken once a day. Disulfiram should never be taken while intoxicated, and it should not be taken for at least 12 hours after drinking alcohol. It works by causing sickness, nausea, headache, vomiting, chest pains, difficulty breathing. And after drinking even a small amount when you're taking this drug, you can be sick for an hour or more. Thus, disulfiram's big advantage is it acts as a deterrent to first the decision to relapse, but also if one relapses, it creates a reaction which is counter-conditioning or unpleasant. Let's talk a little bit about acamprosate. Acamprosate is a medication that typically begins on the 5th day of abstinence from drinking, reaching full effectiveness in 5 to 8 days. It is offered in a tablet form and taken 3 times a day, preferably at the same time every day for consistent blood levels. The medication's side effects may include diarrhea, upset stomach, appetite loss, anxiety, dizziness, and difficulty sleeping. Acamprosate is used to decrease urges and desires to relapse or drink. Now let's talk a little bit about the third drug in this class for alcoholism, and that is naltrexone. You've heard a little bit about that as one of the choices with buprenorphine in the opiate treatments. When naltrexone is used in the treatment of alcohol dependency, naltrexone blocks the euphoric effects and feeling of intoxication in alcohol like it did in the treatment of opiates. This allows people with alcohol addiction to reduce their drinking behaviors enough to remain motivated to stay in treatment, avoid relapse, and to take medications. Now, of course, we must make a caution that when you're taking any of these medications, you can't leave them out in the open and in the house because they're extremely dangerous to children. In your orientation to treatment, at the beginning of your admission, if you had problems with any kind of addiction, you got orientation to these facts and information that I've just covered with you. In fact, this film may have been used with some of you in your orientation. In some of the group education programmings, you may have also seen this film or had some of these facts or different ways of understanding these materials presented to you so that you can become a wise consumer and someone who can use all of the skills and tools useful to stack the deck in your favor, that you'll not only recover from your addiction, that you'll have the least amount of relapses, and that you'll begin to recapture a good and healthy life with all of the resiliency that the post-addiction period of our lives can bring to you. If you have questions, as the clinical director of these programs, my office and the assistant clinical director, Dr. Cooper's office, is always open for you for consultation and help with your program. Thank you very much.